Hi, it's Dr. John Baker. I'm a chiropractic doctor in Longview, Texas, and today's Saturday, the 26th of September, 2009. And I was doing some research for one of my many web pages, and I found an article that was very interesting. It was a study or a survey that was published in the New England Journal of Medicine, September the 14th, 2009. So we're looking at almost just 2 weeks ago. And what it showed, and it was a fairly extensive survey of physicians in the United States, and the conclusions were that two main ones that I found interesting is one, most physicians favor a hybrid system of private and public partnership, and that's basically what the French system is, which I've been saying on my videos, is the best system according to a lot of people more versed on healthcare than I, and also it's kind of generally acknowledged that France has the best healthcare system. The other main point, and one that I found even more interesting, was that the majority of physicians in the United States are favoring the public option. Now, I did a video yesterday about the public option, and why it's interesting is that the American Medical Association has been lobbying hard against the public option. And the membership of the AMA has been dwindling fairly steadily for years now. And I guess I can see why. I'm certainly not a candidate for being in the AMA, and I wouldn't if I were, because I don't think they adequately represent the interests and the concerns of a majority of physicians in the United States. But for all those right-wing nut jobs out there that say that the doctors are against the public option, you're just dead wrong. And if you don't believe it, look at the New England Journal of Medicine, September 14, 2009. You'll see what the survey shows, that the majority of physicians are for the public option. And if you're poor folk or you're middle income folk, you should be for the public option as well, because the public option is basically meant to be a safety net so that you won't have to go into bankruptcy if you have health care bills. And we know that the major cause of personal bankruptcy in the United States is medical cost. Probably one of the big things is hospital bills. I mean, it shouldn't cost $50,000 to get a knee replacement. Costs are skyrocketing. One of my favorite examples is some folks who had a giant hospital bill who hired a guy that had been a hospital coder, and he was going through the list of what these codes were, and one thing that was listed was mucus recovery system, and I don't remember how much it was, $10 or something like that. And when he actually hunted it down, the mucus recovery system was a Kleenex. And they charged enough to buy several boxes of Kleenex for one Kleenex. So we really need a reform of the American healthcare system. It needs to be prevention-based, as Dr. Andrew Weil said when he was on the Larry King show. And I just trying to get the best care for me and you. You know, I mean, rich folks, they can always get the best care. It's us poor folks that have a problem. And without the public option, any bill passed by the House, whether it's the House Bill 3200 or whatever, is going to be a giant gift for the insurance company. And that's not just me saying it. That's Wendell Potter, the former Vice President of Corporate Communications for Cigna Insurance Company. So God bless you. I hope your weekend's going good. Bye.